Hello everyone, and thank you for revisiting my site. I'm Dr. Bina, known as Dr. Handsome, and as I promised last time, I will be talking about Arestin today. And Arestin is an antibiotic that is used in conjunction with gum therapy to improve the health of your gum. And I wanted to explain when you should use it and when you should be aware of the abuse. Basically, between your tooth and the gum, there's a groove. That when it's healthy, it reaches 2 to 3 millimeters, or maybe 4. When it becomes to 5 or 6 millimeters, that usually indicates there is some issues with the gum, and Arestin is one of those agents that is used to improve gum health. It's not the only material. There are other materials by other companies like Atriodox, Periodontal, and other agents that are being used, but Arestin seems to be the most popular one because of ease of use, and also it has good results. And I use it in my office. I don't have anything bad to say about the material itself, but I see there is a potential of misuse or abuse. Let's say you haven't had a cleaning for 2-3 years, and now you want to catch up and get your gum clean. You should start with a deep cleaning. The protocol I use, or many dentists use, is that you come back 3-4 weeks later for reevaluation. And sometimes you may need another cleaning. The reason for it is that at the first session, for some people that they have a heavy deposits, you cannot clean everything. At best, maybe like 90-95% of the tartar or plaque buildup can be removed for many reasons. One reason is that because of gum inflammation, you have a lot of bleeding. That's a visibility issue. The hygienist cannot see everything. And also the other issue is that you don't want to keep scaling on a gum that is very inflamed, because potentially can cause more damage to the gum than good. You have to let it heal first. So when you come 3-4 weeks later for reassessment and a fine-tuning cleaning, we can also check your gums. If there's still a lot of deposits there, that can cause your pocket depth to be higher, so that's why it needs to be cleaned first. When we assess your gum to see where you have the pockets, and then to see what is needed to treat those pockets. Even though Arestin is a good medication, but it's not a one-size-fits-all answer to all your gum treatments. For example, if you have a contact problem with your teeth, like you have an open contact, what we call it, and food gets trapped in there, those who have to dig in after you eat vegetables or meat, you know what I'm talking about. The one that you always have to get a peek and try to get the food out. That's the issue with the open contact, and that causes gum damage and gum pocket. You can put as much as Arestin as you want. It's not going to solve the problem. And the correct problem is to close the contact, whether by changing the crown or filling, whatever necessary. The other problem that can cause pockets is if you have a defective filling, what we call an overhang or step on the filling that can harbor plaque underneath it and cause some irritation. Again, you put Arestin, it's not going to do anything. If you have a cavity that now has traveled under the gum, same issue. The cavity has to be fixed. Otherwise, you can put Arestin over there. It's not going to do anything. Another problem that I see that has to do with the diagnosis is when you have early stages of a root crack, and that is sometimes very hard to diagnose properly. At the initial steps, it can give you a 5-6 millimeter pocket, and it can be confused by gum problem, and people try to fix it by placing Arestin. That is not going to do anything, but again, it has to be diagnosed properly. I have a lot of patients refer to me, and they are telling me they had the Arestin or antibiotic treatment 3-4 times with no resolution, and then we find out there's a crack in the root. And it has become very common because a lot of people have become brushers or grinders. They grind the teeth. If you are missing teeth on one side, you're overstressing the teeth on the other side. If you have a tooth that has a root canal, they are more prone for fracture. These are the things you need to watch out and be aware of. What I hear from some patients is that when they go to all these franchise or like multiple office clinics, they are being told that you need 20, 25, 30, 35 sites that needs to be treated with Arestin. You really need to watch out, because that can cost you a lot of money unnecessarily. And I don't say that you don't have all those pockets. If you really have that many pockets and not going through the proper treatment, the treatment sequence, I should say, maybe you should have a second or third opinion. Maybe you should see a gum specialist or periodontist for evaluation. If you have to treat 20-25 sites by Arestin, with much less cost, you can get a second opinion, third opinion, or maybe another cleaning to improve the overall health. In general, what I'm saying is that it has to be the proper assessment first, proper diagnosis first, and be aware of when you're told 25-30 sites for Arestin, that's way too much. Anyways, I hope that information was helpful. Please come back and visit my future clips covering dental implants, how to avoid getting root canals, how to know when you should get a crown or not a crown. Implants, I have many clips because there are so many things to cover, and one of them it has to do with one day implants that you should really watch my clips before you seek getting all those treatments. Thank you for watching.